thank you all for joining tonight. It is my privilege to introduce our speaker, Dr. Sherry Yaffai. Dr. Yaffai is a cannabis and board certified emergency medicine physician at Providence St. Medical Center. She's been there since 2009. She started her medical career at UCSD, where she completed medical school in 2005, and then her emergency medicine residency at UCSD in 2009. And we've been blessed to have her here in Los Angeles since. In 2017, Dr. Yafai opened her private cannabis clinic, the ReLeaf Institute, and she has become one of the experts in this area. She's the previous co-vice president of the Society of Cannabis Clinicians.
I think I'm recording it.
And a distinguished speaker for UCSD Center for Medical Cannabis Research. And reminder to everyone to mute their microphones, please, if you're not speaking. Thank you.
Take a peek and see if you've got a couple.
Hold on, Dr. Johns, we can't hear you. Hold on.
Oh,
there you go.
Voila.
There we go.
She is the previous co-vice president of the Society of Cannabis Clinicians and a distinguished speaker for UCSD Center for Medical Cannabis Research, the Pacific Neuroscience Institute in Santa Monica, and multiple other medical programs, including ours tonight. In 2019, Dr. Yafai worked with the LA community to put on the first ever CME approved medical cannabis conference. And if any of you know about CME, it is a very robust process to do that. So that's impressive. At the start of 2021, Dr. Yafai took on a new position as the Senior Vice President of Medical Affairs at People Science, with research on the current market as its focus. Her work has culminated in partnership with Ulli Organics, a CBD company focusing on wellness and balance. We look forward to hearing your thoughts this evening on the ways in which cannabis can be applied in medicine. Thank you so much.
Thank you for that lovely introduction, Dr. Johns. Nice to meet you all here today. Tony, thank you for the invitation and always keeping up to date with these things. I'm always so impressed with you. So without further ado, I'm gonna just share my screen here and we'll go from there. Hold on. Okay, so Cannabis 101. I wanted to start here because most people, the very first questions they ask have to do with what cannabis itself is. And it can be very confusing. So let's jump in. You already heard a little bit about me, so I'm just gonna jump right forward. And we're gonna start with a little bit of humor because I take all of my lessons from a little bit of humor. Okay, docs, step away from the mildly psychoactive weed or lose your license to prescribe some highly addictive and sometimes deadly opiates. So this was my perspective jumping into cannabis, because when I first started, I was seeing a lot of opiate overdoses in the emergency department and routinely seeing this happen. It was frustrating, it was mind-boggling, and I decided we needed to do something about it. So I segued into cannabis, and the very first question I had is, what the heck is cannabis? Is it marijuana? Is it hemp? Is it CBD? Is it THC? What is this thing that we keep talking about? And as I learned, and as I want you all to know by the end of the lesson today, is that it's all the same thing, but some parts, we're talking about small parts of the bigger picture. So the bigger picture is the endocannabinoid system. The endocannabinoid system was discovered about 30 years ago by Dr. Mechoulam in Israel. This is our body's actually natural response system that responds to cannabis. It regulates multiple organ systems, most well known for the brain, and there's very small amounts in the brainstem. And the reason I bring this up is because the brainstem is what modulates our automatic breathing systems. And this is why people die of opiate overdose, because of the receptors in the brainstem that respond to opiates. This is exactly why people don't die of cannabis overdose, because we don't have the receptors there that cause us to stop breathing. In our bodies, cannabis binds to receptors called cannabinoid 1 and cannabinoid 2 receptors, plus multiple other receptors. I think we've got about 5 other receptors that have been clearly outlined at this point. We also have molecules within our own systems that function like cannabis, like anandamide and 2-AG. And here's what those receptors look like in our bodies. They are G-coupled protein receptors, and they're responsible for a large number of things, this endocannabinoid system. It's responsible for creating 2-AG and AEA. Those are endocannabinoids. PEA, OEA are, I think, the sum total of all of our cannabinoids that we've got studied to date. They're actually generated from the cell membrane and they have phospholipid precursors. They're fatty. These are lipophilic or fatty molecules. The metabolism of our endocannabinoids is part of this system. So how we break it down, it's broken down by FAAH, F-A-A-H. That's the enzyme that breaks it down. And the way our body responds to these phytocannabinoids, as well as our body's response to the endocannabinoids. As I mentioned earlier, there's CB1 and CB2, which are G-coupled protein receptors. These are involved in regulation of multiple organ systems. I'm going to show you that in just a moment, but this is where it gets really detailed. So when people walk in, they say, oh, I know what THC is. That's called one of our major cannabinoids, okay? Delta-9 tetrahydrocannabinol, also known as THC. It's most well known for our receptors in the brain, and it's very effective for pain management and spasticity. Cannabidiol is the second major cannabinoid that we've got, and this is the non-intoxicating chemical and appears to have limited abuse potential. So whereas we think of THC as being something that adolescents, teens, 20-year-olds abuse, CBD is the exact opposite. It's the yin to the yang of THC. And this is being studied very closely. All right, so the next step here is what are the other minor cannabinoids that are being thrown about? So you'll see in the stores, you'll see if you Google it, there's a whole bunch of alphabet soup that's out there in terms of cannabis. And I think this is the best version, or best diagram, I should say, that shows the process of what these all are. I'm not going to go through them all because there's a lot of detail here, but I want you to look that the top half is raw and the bottom half is heated, and then it goes to old, right? So that's the way cannabis we can think of in our mind. There's some parts that are actually in the plant itself. Those are the raw parts of the plant. We'll even get them in things like hemp seeds. And if you heat it, like if you think of lighting a joint, that's how we get those next activated parts of the plant. So there's also about 400 other chemicals that are what we think of as the essential oils of cannabis. So these are the terpenes and the flavonoids. I was talking to a patient the other day and I alluded to them in a way that I think is a little better for people to understand. If you were going to get a red wine, you know, all red wines are not all the same. And the difference between them is not their alcohol content, but it's their flavoring, right? So Pinot is different from a, I'm gonna botch all my alcohols. You guys are gonna know I'm terrible at drinking. A Pinot is different. A Pinot Noir is different from a Chardonnay, which is different from a Rosé. These are not the alcohol contents that differentiate them. They're the other parts of the plant. They're where the grape grew, that gave it its flavor, its scent, its smell. And these terpenes and flavonoids are just like that. And that's why when you look into these cannabis dispensaries, sometimes people feel very overwhelmed by the options because of all of the different flavorings that go into this plant. Beta-Carotene is probably the most well-known terpene. It's also found in rosemary. And this is found to actually bind to CB2 receptors, which is so phenomenal that we've got some other plants that we're seeing also bind to cannabinoid receptors. Linalool, which is also found in lavender. It's a very calming essential oil is what we think of. It's good for sleep as well as seizures. Limonene is also found in lemon, myrcene in mangoes. And then we get to where all these different receptors are. If you take a step back and you think about how cannabis is helpful in multiple different disease states and organ systems, one of my biggest questions starting in this was, how can something be good for seizure disorders and also be good for rheumatoid arthritis? How do those two things overlap? Because in my mind as a physician, those diagnoses never overlap, right? We don't see people with arthritis also have epilepsy. So how is it that cannabis or CBD can be good for both? And it's actually very simple. It has to do with where those receptors are located. So in preparation for this talk, I went scouring the internet and PubMed and Google and anything I could find to see if there were any cannabinoid receptors on our vocal cords. And I couldn't find any data on it. We do have CB1 and CB2 receptors on our lungs. We do have cannabinoid receptors on our cardiovascular system, including our blood vessels in our heart. We do have cannabinoid receptors on our lymph system and also on our immune tissue, all of which can more or less coalesce in vocal cord areas, but not the vocal cord itself. Is it because we've studied it and we found there weren't any there? I don't know. Is it that we haven't studied it and that's why we don't know where they exist? That's a possibility. But you can see here that CB1 and CB2 receptors span almost every single organ system in our bodies. So, does it all go up in smoke? More commonly, people nowadays know that you can use cannabis in more ways than one. There are a lot of different ways that you can use cannabis. You don't have to smoke it, which is the advantage of here and now in 2021. Sorry, that didn't come out. But inhalation, you can smoke it, you can vape it, you can dab it. These are all different versions of getting it through your lungs. You can get it by mouth by ingesting it in edibles and sublingual formats. There's honey, tea, brownies, cookies, chocolates, hard candies, gummies. There's oils and sprays. Every time I turn around, there's a dispensary carrying something new with a different flavor. You can find gluten-free, sugar-free, vegan. You can find almost any version of this that you want, which is really phenomenal because we've got the minds of millions of people pouring into these products as opposed to 4 chemistry scientists sitting in a lab in the basement. So we've really got a lot of advantage in this plant and products. Now, you can also use them with G tubes and NG tubes, which is really important as we start dealing with very sick medical patients. We can also use this in topical format. So you can use it, Dr. Johns, you won't believe this, but I've used it topically post tonsil removal to help with swelling and pain around the tonsil area externally. So it's got some really nice adjunctive means of use. For the ladies in the crowd here, we've got intervaginal suppositories. We've also got topical sprays for clitoral stimulation as we pay attention to more and more female needs. We've also got rectal suppositories. The suppositories tend to be used more in cases of cancer or endometriosis or menstrual cycle related issues. And then lastly, we've got sublingual melts, kind of like Listerine tabs available on the market. So, is there any data on spasmodic dysphonia and cannabis? Does it work? This was what Tony tasked me to do for all of you today. And I am sorry that I only came up with one review article. And I went through PubMed, which is our medical version of a library. And I looked through spasmodic dysphonia. I looked at marijuana and spasmodic dysphonia. I looked at cannabis and spasmodic dysphonia, CBD, THC. I think I even at one point looked at pot. And out of all of these different ones, we only found one review article, which was actually fairly recent, looking at how could cannabis inhalation affect voice disorders. And this was a systematic review. In this review, they cited this particular article from JAMA in ENT surgery in 2019. And what they found was that there are I take it back. There are no data on cannabinoid receptors on the vocal cords, like I mentioned earlier. This was really important to me because this is how we know how things affect our body. If there's no key to the door, we can't expect it to go inside the house. So if there's no key to the organ system, we can't expect there to be a response, okay? What this article did find was that vocal pitch and voice quality, auditory perceptual ratings by naive and trained listeners fell within normal limits, both with and without cannabis smoking. Part 2, they found that some participants reported strain or hoarseness when asked about the effects of cannabis on their voice during times that they smoked it. So this had to do directly with the effects of smoking cannabis on their voice. The last thing they found was that visually cannabis smokers did have darker vocal cords. Dr. Johns may be able to relate back to us later after the talk about how darker vocal cords can affect or how that could be interpreted in terms of spasmodic dysphonia.
Or I'll question the finding.
Right,
Stay tuned.
Okay, good. So the next kind of study, this same study was interpreted again, and what somebody else interpreted this as was smoking harms the throat. People noted some dry throat, hoarseness, low-pitched voice, and unclear articulation. Some commented on altered voice rhythm and fluency. Again, this all correlates back to smoking, not to any of the other ways that we have talked about so far that you can use cannabinoids. So I wanted to bring 2 clinical presentations that I've seen in the office because I've only had 2 patients with spasmodic dysphonia in the last 5-6 years that I've been open. In patient number 1, she reported back that it helped her calm down, but it didn't necessarily help with the spasmodic dysphonia. It didn't help with her voice. Patient number 2 reported that it was mildly helpful for sleep and some low back pain, but again, it didn't help specifically with spasmodic dysphonia. Neither patient smoked, but both used either an oil and or a cream. I called patient number 1 about 2 years after we started, and she noted that she stopped using the oil products, but she later did try smoking, and she independently found that it gave her a pleasant kind of smoker's voice. She actually liked it. People commented that she had a very nice kind of throaty voice. So she enjoyed that aspect of it. Now, oftentimes I do what all my patients do, and I will Google things because I find that the medical literature, especially in 2021, in terms of cannabis use is lagging. And one of the things that made me appreciate cannabis for what it was not always the medical literature behind it, but actually what patients were saying about it. And from the time I started my office, I noted that if you looked things up on the internet, you would see patients kind of screaming from the rooftops how much cannabis had helped their rheumatoid arthritis, their cancer treatment, their chemotherapies, their Parkinson's, their dementia. So we really do see a lot of this being voiced amongst the people in the crowds. Again, across the entire world, you have access to with Google. But in this case, I didn't find that many. I found, again, just 1. And this was from NSDA, National Spasmodic Dysphonia Association. And this was a direct quote from their website, which was CBD and medical marijuana, which again, we know is not the same thing, right? CBD is the non-intoxicating part of the plant, and medical marijuana is usually a reference for THC. So CBD and THC has not been studied specifically for relief of SD. However, people anecdotally have reported temporary relief of symptoms of their SD after using CBD and or medical marijuana. I took it one step further and I went and looked at Facebook. Again, you expect people to announce this from the rooftops if they're feeling better. I searched high and low, and I found 2 comments on it after a post on CBD and spasmodic dysphonia that had been previously removed. And this person reported the following: I've been suffering from a light form of SD since about 10 years. I've never been so bad that I can't speak, but my voice cracks here and there, and moreover, I was a singer before SD, and that I can't do anymore. My voice is too bad for that. I tried many different things to recover. No way, till I ended up trying medical cannabis, which is legal in Italy. The product I was given is named Beta-Carotene, a mix of CBD and THC in oil. I've been taking it since October, but so far I've not had any remarkable results. As you're writing about CBD only as a remedy, I wonder whether that could work better. So there was about 20 posts, and these were the only 2 posts that commented on one way or another how it affected them. So this was the second post. Hemp oil, 1,000 milligrams, helped my voice a lot. I did Botox and steroids, but received the most benefit from oil. So, conclusions. We've seen not a lot of very promising data about spasmodic dysphonia and cannabis, right? I was quite disappointed actually as I went through all of this. But I did find something else in that one review article, and I wanted to bring it here. CBD was found to be associated with reduced antigen-induced bronchoconstriction. Part 2. I'm not going to be able to pronounce that name, sought to probe possible synergies amongst 6 phytocannabinoids on bronchoconstriction using in vitro and in vivo methods. The THC alone had antitussive and anti-inflammatory properties. THC plus CBD was associated with a complete cessation of tumor necrosis factor, alpha augmented electrical field stimulation contractions, and THCV was associated with only a partial reduction. Preet et al. Observed THC to have anti-tumorigenic and anti-metastatic properties on non-small cell lung cancer. Ribeiro et al. Revealed that single doses of intraperitoneal CBD had a potent anti-inflammatory association with LPS-induced lung injury in mice. So I wanted to bring this here because my real conclusion is it's not just one thing. Spasmodic dysphonia, unfortunately, if you want to try and use cannabis as a means to evaluate if this is going to help treatment, I'm not opposed to it. I think the downside, as I've shown, is little to none. But I think there is one other big upside, which is SD is not usually in isolation. And in talking to a few of my SD patients, colleagues, etc., what I have found is that it's anxiety provoking, it's frustrating. We oftentimes see other things like tremors, mood disorders, insomnia, sleep disorders, anxiety-related issues that go hand in hand with SD. And potentially that's really where we can make more of a benefit for patients as opposed to treating the actual SD. I think SD for now is going to be better treated in the hands of individuals like Dr. Johns than it is going to be just yet in terms of cannabis. And I think we still have a lot more to look into. I don't throw the baby out just yet. We're going to take a look and see, where we can get more benefit. I think the very first step is just to find out if we've got receptors on our vocal cords. If we do, then maybe we've got a lot more to come. All right, a couple resources for everyone out there. Social support online, because that's the way we all connect these days. I do write an emergency medicine news column called The Case for Cannabis. I write a column every month. Please feel free to go online and take a gander at that. You can find me at the ReLeaf Institute on Facebook, or I'm getting used to these words. I think it's called my handle on Instagram is Dr. Sherry MD Relief. And if you have any questions, you can reach out to me directly, sherry@mdrelief.com. Thank you again so much, Tony and Dr. Johns and team, for having me out here today. as I mentioned, this is a wonderful resource and organization you guys have here. I'm sorry, I was very frustrated putting this together to not be able to show more positive outcomes out there.
Thank you so much, Dr. Yafai. Round of applause. All right. Well, we'll open it up for questions and answers in a minute. I just want to comment briefly. Thank you. Really interesting. And there's so much that we don't know. I wanted to comment just briefly about the smoking and the dark vocal fold. So that particular study was from like the 1980s, and the technology around which you could see it was really poor. And so it's really hard to trust any sort of laryngoscopic findings from there. But what we do see is the same findings that we see with inhaled smoke of any variety. And there's nothing really particular about cannabis versus tobacco versus, even, crack cocaine. Really, it's the heat and toxins. And typically people smoke cigarettes more than cannabis in quantity. And so I haven't noticed in my career any sort of visual changes. But we can't endorse smoking things in general, just because the risks of even local irritation are real, leaving aside cancer risks. And so but with cannabinoids, there's obviously a lot of different delivery methods.